European Lung Cancer Congress in 2025 will kick off March 26th from Paris, France. This is a joint conference held by IASLC and ESMO, and I think it provides some important updates. This year's agenda, no exception, some really in-depth discussion, some important data coming out of this smaller meeting. This is a meeting where it leaves a lot of room for connection, for discussion, for networking, a favorite among lung cancer oncologists. This year, I think some important data to be shared and will be processed there and beyond. I think the biggest will be the overall survival data from MARIPOSA. MARIPOSA, the phase 3 trial showing that frontline amivantamab plus lazertinib was superior to osimertinib, significantly improving the progression-free survival. And we learned by press release in early 2025 that did translate to an improvement in overall survival. The teaser from the press release showing that improvement in survival approaching 1 year difference in terms of the median. And so we'll see those data for the first time publicly at ELCC 2025 from Dr. Jim Yang from Taiwan. And so really looking at those survival curves and seeing, should this really become our new preferred treatment? Countering the survival is certainly the increased infusions, the risk of VTE, other toxicities, but really the magnitude of benefit, I think, will really frame whether we should be changing practice in more patients. We'll also see an early survival readout from the LAURA trial, another EGFR study here for unresectable stage 3 non-small cell lung cancer, patients who completed chemoradiation, randomized to osimertinib or placebo. We saw osimertinib with a profound improvement in progression-free survival, the hazard ratio around 0.16. And here we'll see what impact did that have on survival. A reminder that in the LAURA trial, osimertinib was given indefinitely until intolerance or progression. And so while that data will take some time to mature, we get an early readout as to what those survival curves look at. We'll also see other data at ELCC. One that I'm interested in is the Crystal-7 trial from Dr. Marina Garcino. This is a small trial, but really looking at adagrasib plus pembrolizumab for KRAS G12C. This is a setting where we have a targeted agent. We have two, sotorasib and adagrasib, both approved for KRAS G12C, but both approved in later lines of therapy. And primarily it's because we know that subset, KRAS G12C, can derive significant benefit with immunotherapy. We don't want to deprive someone of the opportunity to get a long-term immune-mediated benefit. So immunotherapy remains the standard of care for KRAS G12C. One wonders if we should combine these, learning from EGFR and other drivers that when we combine targeted agents plus immunotherapy, sometimes that does lead to increased toxicity. And indeed, early on with sotorasib, it did seem that combination seemed to be a little bit too dangerous to pursue. Certainly, you don't want to cause immune-related adverse events and lead to someone stopping immunotherapy, interfering with immune responses. And so Crystal-7 really looking at adagrasib and pembrolizumab. Is it more effective than we might expect from either agent alone? And is it safe to do? And so I think that these data will be important to look at pretty closely. Our colleague from Germany, Dr. Martin Reck, will present some data from Keynote 799, actually the final analysis, this a study of chemoimmunotherapy for unresectable stage 3, looking at the Pacific 2 trial, where giving immunotherapy with chemoradiation was potentially detrimental, or one would extrapolate inferior to using durvalumab after chemoradiation. 799, a slightly different approach, but the same type of principle. And so it'll be interesting to see how those results fare to historic controls like Pacific and to more recent negative trials like Pacific 2. ELCC is a place where we will have some plenary sessions, some proffered papers, some mini oral sessions, also some opportunities for young oncologists to interact, but we'll also see some educational sessions. And one of the interesting sessions that I've got my eye on is one on artificial intelligence and how AI can improve outcomes in the treatment of lung cancer, looking at response assessment, pathologic assessment, and really decision-making. This is a field that is rapidly evolving. This session will be chaired by Dr. Arcela Prelage, from Milan, was also one of the speakers. And so this is a topic that's evolving very quickly. That session really going to bring people up to speed with how we should be looking at AI and really integrating it into our current and future trials. So ELCC, I think, will be a very interesting meeting. For those who can attend, it'll be in Paris, France. For those who can't, there are wonderful virtual options. I'll be attending virtually myself, so I really do look forward to it.